diabetes distress can lead to diabetes burnout and like the extreme situation.
Right.
And then over in kind of a separate column is clinical depression that, that we use antidepressants for. They're very separate. So then if I'm listening, I'm wondering, how do I know when my usual frustrations are tipping over into distress or potentially burnout? When do I need to be, concerned, or what are the signs and symptoms, I suppose?
Huh. Well, it may be hard for me to answer that, and I'll tell you why. Our best evidence suggests that problematic diabetes distress, elevated levels of diabetes distress, occur in maybe 3/4 of people with type 1 and type 2 diabetes. And what that means is if you aren't going through time, if you aren't going through what you guys are talking about, if you aren't getting frustrated and upset and overwhelmed and aggravated.
You get mad too.
Yeah. I mean, if you don't have that, actually that's weird. It's normal to be annoyed for all the things, Jeremy, that you talked about, right? Diabetes is a job you didn't volunteer for. There's no pay, there's no vacations. You get to do it forever. And that degree of attention you have to pay, where it can be really frustrating too, can get to everybody. I always like to say that if you ask the next 20 patients you see, Mrs. Smith, nice to see you. Can you tell me one thing about diabetes that's driving you crazy? You're never going to meet anybody who's going to go, yeah, no, it's all good. Really can't think of a thing. So it's there to some degree for everybody.